Hey everyone, in this video I want to quickly go over some common misdiagnoses of endometriosis. I'm Vivian, and for those of you new to this channel, I've been solo traveling around the world for the last 10 years and I've been in pain for the last 15 years. When I say pain, I mean extreme pain during my period that keeps me in bed for a few days at a time, wakes me up at night, has made me throw up, and has made me pass out from it. On this channel, I'm sharing what I've learned from my travels through 61 countries, and I'm documenting my own health journey from letting other people dismiss me and tell me it's all in my head to becoming truly healthy. Just a quick disclaimer, I want to say I'm not a doctor. I'm just a patient sharing what the latest medical research has found and what the latest literature says out there. So the first common misdiagnosis of endometriosis is IBS. One of the most common group of symptoms of endometriosis is digestive issues that can look like constipation and or diarrhea, severe abdominal bloating. I made a whole separate video on endobelly and severe abdominal bloating up here. And basically, when you go to a doctor and you talk about your symptoms, they're going to say you need to go to a gastrointestinal doctor, and that doctor is going to say, oh, you need a colonoscopy or an upper endoscopy or both. And when they do all of that, they might say you have IBS, which is an umbrella term for many symptoms, often unexplained, of the gut or the intestines. That happened to me, and something else I got diagnosed with along the way was GERD or heartburn. So all of these digestive symptoms, like, you might actually have them, but at the same time, they're misdiagnosing the root cause, which is a chronic illness. So endometriosis is an inflammatory disease where the tissue inside your uterus that should be shed every month on your period is growing outside of the uterus. 10 to 15% of women have this, 15% of Asian women have this, and we all have seen someone walking around with it if we've gone outside into the world before. The second common misdiagnosis is pelvic inflammatory disease. I would say endometriosis could cause problems that can later, if left untreated, actually lead to pelvic inflammatory disease, but the pain and inflammation can often just look like pelvic inflammatory disease. And even I've been told by doctors looking at ultrasounds that one of my fallopian tubes looks quite tender or inflamed, and that might impact my fertility and something's going on. That's an example of highly suspicious endometriosis being just written off as something else and being missed altogether. Another common misdiagnosis is cysts and fibroids, although these growths on the ovaries and inside the uterus can totally be a co-condition of the disease. You really are not addressing the actual disease itself that's still there. Painful bladder syndrome kind of used to be called interstitial colitis, and alongside the bladder stuff, UTIs. These two things, like one with the two names and a UTI, are common misdiagnoses of endometriosis because the inflammation in the disease over time can damage the lining of your bladder, so it can cause the feeling of burning when you're going to pee, and doctors or friends that you ask for advice might think you have a UTI, or you might think you have a UTI, and there's actually no need to take antibiotics because there is no infection in your urethra or the tube where you're peeing from. It's actually just damage to your bladder from a larger systemic disease at hand. I'm not saying like you don't have the painful bladder syndrome, I'm just saying you have endometriosis and now also the painful bladder syndrome. And to address the painful bladder syndrome, I'll link a book down below that really talks about everything you can do. One of the keys is to eat a low acid anti-inflammatory diet. Some of the main acidic culprits to avoid for a few months when you're doing this diet and prepping for the surgery that's going to ultimately take the endometriosis out of your body include carbonated drinks, vitamin B supplements, tomatoes, and citrus. The fifth misdiagnosis for endometriosis is anxiety, and this is the one that makes me laugh because it's happened to me. I've gone to a gastrointestinal doctor with all my symptoms and asked if I had, maybe also mold toxicity or some parasite that I'm not catching that's causing this unexplained bloating, and that's because I've gone crazy and have done all this reading. And they were like, oh, maybe what you're reading online isn't true. And then without telling me that they even thought I had anxiety, it was like on my medical report. All very highly unprofessional and just laughable. And I was prescribed an anti-anxiety medicine. And I'm not saying I don't have anxiety, not at all. I'm just saying this is a misdiagnosis of the underlying disease going on. So having anxiety and even OCD, obsessive compulsive disorder, are common co-conditions of endometriosis patients. Another misdiagnosis or possible confusion with endometriosis is adenomyosis, where this tissue that we're talking about that needs to be taken out is growing inside the walls of the muscles of your uterus, and so that can have the same presenting symptoms as endometriosis, but it's something different, and the only way to know what's what is to have a minimally invasive surgery. Surgery is the only thing that can tell you exactly what you have, and there's two types, so really do your research and make sure you get endo excision surgery. Those three words are key. And then the final common misdiagnosis of endometriosis is nothing. I think this one is the worst one because it leaves the patient feeling out of control with their life, feeling desolate at times. It really impacts your mental health and confidence, and you kind of lose touch with reality. You're like, oh, everyone else can do all these things, but when I do them, my body punishes me. And I think that's really toxic. There's a lot of medical gaslighting that is talked about in the medical world when it comes to endometriosis. It takes a long time to detect and diagnose. It can take on average up to 10 years to diagnose. For me, it was a lot longer, and for many women, it can be decades. The most poisonous misdiagnoses is nothing, and a lot of friends or family might just kind of dismiss you or make you feel disbelieved. So this can just all delay everything. Doctors will also not believe you or just dismiss your symptoms. So the solution to all of this, no matter what health problem you're going through, because no one has perfect health, is to read updated, high quality literature on your symptoms and to never give up. Don't let other people tell you that there's nothing wrong with you because you look fine to them. You know the truth. If you think you have endometriosis, follow informed endometriosis specialists that are constantly staying up to date with the latest findings, and also pelvic floor physical therapists. Book an appointment, go after more than one opinion from medical professionals. The only way to 100% diagnose and see endometriosis or adenomyosis, and also to get rid of the tissue that's causing the pain and inflammation, is through endo excision surgery. I'm going to say those words again, endo excision surgery, because the other type of surgery that insurances can automatically just refer you to only scrapes away the problematic tissue or burns it off. They don't take the whole thing out at the root. And endo excision surgery plus pelvic floor physical therapy together is really key in overcoming the disease. And if there's any other co-condition going on, those have to be addressed separately. You can't get around the surgery part of everything, because the other stuff is going to keep happening as long as you still have the untreated growths going on inside of you. I know this is all really scary, so I hope this video just helped explain what might be happening. I hope you don't feel too overwhelmed, because that's often happened to me, and I hope that you feel like you can believe in yourself again, no matter what you're going through, to keep chasing down your answers, and that you're not going crazy, and that health really does come first. And sometimes it's not linear, your progress in finding your answer, and it's not linear how much you might have to spend, and just be okay with seeing coming out of your bank account until you get the answer, until you get healthy. But honestly, nothing is really enjoyable in life if you're not healthy. I've made a whole video about not being healthy while traveling the world, and now all the light is gone, so this video looks crazy, but I hope everyone has a good day.